Welcome back to Central Valley Talk, where we celebrate what's good about Fresno and the whole valley for that matter. There's so many good things going on out there, good programs, good people helping other people, and we like to spotlight them and let you know what's going on in our community, especially coming up to the holiday season. Our next guest is Robertson from Pinnacle Treatment Centers. What do you treat?
We treat addiction, mostly opiate addiction, but we do, if a patient wants it on their treatment plan, we'll discuss alcohol or other substances as well.
Yeah. Now, I hate to just jump into it, but one of the biggest impediments to people getting treatment is their insurance doesn't cover it.
Yeah, so, that seems to be a problem for a lot of people, but we're a program that takes Medi-Cal as well as most major insurances, and a lot of insurances nowadays are moving towards having that kind of mental health substance abuse treatment.
It covered. Yeah, and people think, they're on, opiates, that they're drug addicts. It's just people who got into, maybe they were in an accident, they hurt their arm, they hurt their back, and their doctor started them on it, and then they couldn't get off.
Unfortunately, that's happened with a lot of people where, maybe they were in an accident, they had some kind of pain issue, they got prescribed prescription painkillers, and then because of this whole opiate epidemic, there's been a huge crackdown on doctors prescribing those things. So a lot of people have been cut off that have chronic pain problems and have been using those for years, and that has resulted in people turning to street drugs and fentanyl and other things that are out there.
And I know drug abusers or drug users, those who need treatment, I know they have a stigma, but they're usually everyday people who, got hurt or something, had to.
A lot of times, yeah, there are people who are, addicts who started using recreationally and it just went from there. But then there are people who are just regular people who got addicted through a doctor prescribing it. And it's unfortunate because, addiction is a disease of the mind and it happens to anybody. Like, there is no discrimination when it comes to addiction, yet we tend to discriminate against those who are addicted.
We do. I want to ask you, we're coming up to the holidays. Any special messages or ideas or how we should behave? Or
Absolutely. So the holidays are a really hard time for people who are in recovery. And one of the biggest things is, people fear going to their family members' houses, especially when they're in early recovery or they're struggling with their addiction, because they're afraid of the judgment that comes from their family. And so one thing that I always do with my patients is I create what's called a holiday survival plan. And so we go over, like, what is it about this holiday get-together that could be triggering to your addiction per se? And we kind of identify what their personal triggers are and develop a plan for them to either cope with those triggers while they're there, whether that be, an aunt and uncle or other family member being judgmental, or there being alcohol there or some other substance like marijuana. And then we talk about having an exit strategy.
And I was going to ask you that.
Yeah.
Do I have to act different? Like, we're all partying, having a drink for Christmas or something. Do we need to tiptoe around the person in treatment or in recovery?
Not necessarily. So part of what I talk about with my patients in recovery is you can't expect other people to change for you. You can, set boundaries of maybe not going to something like that because you might be triggered by that type of environment. But at the same time, if you feel obligated to go, having an exit plan so that if you are triggered or you feel a certain way about it, you can leave in a good way.
All part of your holiday.
All part of the holiday survival plan.
Survival plan.
What I recommend is, they identify a reason to leave ahead of time. Like when they get there saying, I can't stay long because, I've got the dogs at home. I got to let them out after a couple hours. Or, I've got to work really early tomorrow, so I'm not going to be here late,
so
kind of thing.
Plant the seed in advance.
Yes, and that way when they do leave early, it's not a big surprise. Another thing I recommend is so a lot of Hispanic families, there's a lot of drinking involved at holiday and family get-togethers. And so, for a lot of people, sometimes that's too much of a trigger. Yeah. And so avoid it altogether.
Don't go.
Yeah, and don't be afraid to tell your friends and family, hey, as much as I would love to be there, I'm in early recovery. This is something that's too triggering for me right now, and I can't go. And most of the time people understand. If somebody pressures you into going anyways, then you just got to kind of set your foot down and say, it's not good for me, so I can't.
It's not the environment I need to be in.
Exactly, yeah.
Now, what about people out there who are struggling and looking for a way out of the life that they just seem trapped in? How do they talk to you guys? Is there
So you can see our phone number on the screen.
Anybody can call that number.
Anybody can call that number to get a hold of our local clinic in order to set up an intake or even just get some questions answered. There's so many treatment resources in the Fresno area, and a lot of people don't understand that the help is out there. You just have to reach out and ask for it. Unfortunately, your friends and family can't force you into treatment. They can't push you into going. They can encourage it. They can suggest it. But the real decision comes down to the person who wants the help actually reaching out and getting the help.
Who calls you the most? A person who needs help, or a family member, or a spouse?
It just depends. Sometimes family calls, sometimes the person themselves calls, sometimes people just show up at the door. Yeah. They Google the address and they show up and they ask for help. And so, there's different ways that people can do it. And we also, you can also go online. You can Google Pinnacle Treatment Centers. Maybe you're not from the Fresno area. Maybe you're from somewhere else in California. We have, so our treatment center is called Aegis, but it's done under Pinnacle Treatment Centers. We have Aegises all over California. And so the help is out there, and it's not just Aegis. There's other treatment programs in Fresno that are, other types of treatment. We're opioid treatment specific, where we offer methadone maintenance. We offer buprenorphine. We have a 21-day detox program. We drug test. We do counseling on a regular basis. So we offer a lot of stuff. But in addition to that, there's other stuff in the community. Like I have some patients that do our program that are also in residential programs like West Care or CAP or even Turtle Lodge through Sierra Consortium. I have some people that do outpatient programs, which are group therapy, in addition to what they do with us in individual counseling at Aegis. And so, there's programs like Fresno New Connections and West Care and, Aspire Counseling. Those are all different agencies that offer other types of services besides what we offer. And so for some people, we might suggest, hey, do our opioid treatment center, but you need additional support. So we recommend going into residential or doing this outpatient program in conjunction with what we're also doing.
We'll do that evaluation, see where they are, what
Absolutely.
they can handle, what they need.
Yes.
We'll do whether they need to keep working, going to their work, or whatever it takes. So,
yes.
I just wonder if a family member can call, meet with you guys, find out the whole program, what their insurance would cover, then you go to the person who's having trouble and say, look, we got this all taken care of. The insurance will pay it. They're ready to take you in. You ever go that far?
Yeah, so we've actually had people call in that were friends or family and say, hey, I know somebody that really needs help. I want to get more information because they're not just going to go on their own, and I want to kind of push them in that direction. And, there are times where, maybe a spouse calls, hey, my husband's having a really hard time, my wife's having a really hard time. I want to know what their options are to suggest treatment.
Now, just my mind's triggering with a million questions. Sorry about this. But so if somebody has no resource, no money, let's just say no money, and they've hit the kind of a low and they're not earning money, you're saying you might be able to help them get on Medi-Cal?
So usually we would recommend them to talk to an eligibility worker to get applied for Medi-Cal. Once they have the Medi-Cal, we can start them on the program with us. However, we do offer self-pay as well on a sliding scale. Maybe they don't qualify for Medi-Cal, but they make too much to get, or they don't make enough to get private insurance. In those cases, we can offer self-pay on a sliding scale as well.
So there's a way for everybody.
Absolutely.
And nobody just has to keep living that life and destroying themselves and their family members and people around them, but they need to go talk to Sherry Robertson at Pinnacle Treatment Centers.
Yeah. And so, and it's not just like the fact that we provide the methadone treatment or the buprenorphine treatment. It's the counseling part that's the most important. That's the part where we do case management. That's the part where we do referrals and consultation with other agencies. That's the part where we provide encouragement and try to help people, find a direction. So as a counselor, we do a treatment plan with our patients. So when they come in and we do their initial assessment, we kind of determine what their needs are regarding medical, substance use, mental health, employment, legal issues, all those different areas. And then once they're enrolled and we've done that assessment, then whatever counselor they're assigned to will then make a treatment plan with that person and help that person to identify and develop goals for their treatment process. And then we start working on those goals with them in their counseling sessions and kind of help hold them accountable to staying on track with those things by asking them about it every week.
Nice.
Yeah.
Do you have a residential as part of your program?
No, so we don't
Or you
have a
support other
residential. Yes,
yeah.
we do recommend other residential programs in Fresno County to people who may need that higher level of care in addition to our services. And we do work with the different residential programs to be able to continue providing their methadone or buprenorphine while they're in that residential, as well as them still being able to do counseling. So we're able, because we do a lot of telehealth counseling as well, and so we're able to call them on the phone at that treatment center and provide their counseling for them while they're in there, in addition to whatever counseling they're getting while they're in that program.
Things have come a long way with technology. That is good. It's helping your industry?
Absolutely. So we do video and telephone as well as in-person, face-to-face. So if somebody needs something where they need to be sitting in front of a person, our clinic does have that availability. We have counselors who are in clinic and who can provide that counseling. For somebody who maybe lives in one of our outlying communities like Carruthers or Prather or Auberry, they can set up telehealth counseling to alleviate that commute to the clinic to have to do their counseling that way.
That's extraordinary what you do. I ask a million questions. You have all these notes. Anything else you want to add?
I think I pretty much covered everything that was in my notes. I got a pretty photographic memory, so I just kind of glanced over them a little bit. But, the main thing is, our opioid epidemic is growing right now.
It's still growing.
It's not looking like it's going to stop anytime soon. There's a lot of regulations and legislation going into place to kind of try to limit the amount of prescriptions that are being prescribed to people. The DEA and our law enforcement border patrol is working on the fentanyl coming across from Mexico into the country, and us as counselors are working hard to try to help people develop the tools and skills they need to get sober and avoid relapse. And the reality is with the stigma on addiction, there's a lack of support from friends and family to these people. And the reality is when the people you love lose faith in you, you start to lose faith in yourself. And that's the biggest thing is sometimes we have to give those people hope, and we have to remind them that, just because you've hit rock bottom doesn't mean that you can't come back from it, and realistically, not every family member or friend is going to understand what that person's going through because they haven't experienced it themselves. Right. And the best thing that we can do as people is just be supportive. Don't be enabling, be mindful of not enabling that person or over promoting the support to have them end up using more. But also we don't want to be persecutors of them. They understand that they've made mistakes. They understand that they're not making the right decision. Yeah, they don't need that added persecution because, that tends to lead to the mentality of, well, they don't think I can do it, so why should I even try? Yeah.
But you can try. There's hope. There's help.
There is hope.
You got to get the right place, and Pinnacle Treatment Centers will help you. Either they're the right place or they'll help you find the right place.
Absolutely. If we're not a good fit for a patient, we'll definitely make referrals necessary to get them to where they need to be.
Very good. Last thoughts?
Just be mindful this holiday season that sometimes this is somebody's first Christmas sober, or maybe they're still struggling with their addiction, and let the focus this holiday season be on the love and support and family gathering, and not so much on the mistakes that person has made or where they're at in their recovery, because the reality is they need that support and they need that love if they're really truly going to be successful.
Very good. Charissa Robertson. She's a CADC too.
Yes.
And we appreciate you very much and what you guys are doing for our community. We'll be back with more Central Valley Talk right after this.